spinning
Kick your left
your
leg
live.
instead of live. Well, we're live. It's 2:45, and today, first of all, I want to give a shout out to Dr. David Hall of North Shore Rehab out in Illinois. He sent me a pretty interesting email about how he uses flexion exercises, and he's not such a proponent of the McGill protocols like I am. And the bottom line is, everything's got a place. That's where your doc comes in. That's where I come on board with Mike to figure out what exercises you need and what progression, and to make sure you do them right. Because if you're doing them wrong, number one, it's not going to help. Number two, if you're not doing the exercises that are best for you, it's not going to help. So yes, these videos are great, but coordinate the care with the doc if you're a patient, and if you are a doctor, do it thoughtfully. You just don't give somebody a bunch of exercises and say, here, these are for your back, and expect it to work. You got to put the work in and tie it together. So Mike, say hi to everybody.
What's going on, everybody?
He's on camera today. We're going to talk about flexion exercises, or the Hodges type of series, and here's your progression. Turn sideways. What we have to teach you to do is get that curve in your back rather than maintaining it. Some people have it accentuated. Give me like an accentuated. Yeah, they got that sway back. We have to flatten that. So we have to teach them to do that. Exercise 1, back against the wall. If they can't do that pelvic tilt, that Pilates thing I call it at all, feet about 6 inches away from the wall, hand behind the back, there'll be a big space there. Flatten that, okay? And when you can get their back up against your hand, take your hand out. Now flatten it. You want to get your back up against the wall. Hold it for about 10 seconds. If that's really difficult, you may need to bend your knees a little bit to cheat. But you need to do that before we can go to phase 2. Let's go on the table. Phase 2, we're going to be doing the exercise with gravity fighting it, so it's going to be harder. Again, it's all about in through here. So put your hand in there and flatten. Boom. Now, you're not hollowing. Mike, can you show them how to hollow? Relax. How you suck in. You don't want to suck in. It's not hollowing. It's flattening. They're different. Okay? So, once you can do it without your hand there, you can do it again. Flatten. They make these devices that look like blood pressure cuffs that you can slide in there and you can measure the amount of weight. And if you want to do that, that's fine. The bottom line, you have to be able to do this. Hold for 10 seconds and for 10 reps without shaking. First, that's the second position, first on your back. Dead bug position. Next progression, arms up too. Arms up, legs up, they call this the dead bug position. Flatten. Back's against the wall. Hold it there, move one arm. This stays down the whole time, recover. Move one arm. This stays down the whole time. If this starts to arch up, just move the arm a little bit. Okay? Move the arm as far as you can without this arching up. Relax. Now, just like quadruped progression, flatten. Move one leg. This has to stay flat the whole time. If your back starts to arch up, only move the leg a little bit. When you can do single arm and single leg, guess what? Relax for a second. The next one, flatten. Opposite arm and leg, go. The back has to stay down the whole time. That's the whole point of doing this exercise, is to get you here while you're moving your arms and legs, okay? The Hodges progression, and keep going, all right? Lastly, to do this, relax your arms. You're going to bring your heels down here. This is an eccentric loading of the iliopsoas muscle with engagement of those deep core stabilizers. Very aggressive. Flatten. Scoot the legs out as off the table. Scoot them out, scoot them out. If your back arches, drop the feet down. Come up. Flatten. And then scoot the legs out. The goal is to be able to scoot them all the way out by maintaining the flattening here and tension here. And once again, you're not hollow. So there's your progression for flexion strengthening exercises. They have a place just like McKenzie's neutral spine have a place. Talk to your doc about what works best for you. I'm Dr. Donald Lefebvre. Thanks for tuning in, and hey, like and subscribe. We'll see you next week.